We conducted this study to provide additional evidence on some novel technologies, which are drug-eluting stents without a polymer coating, so polymer-free drug-eluting stents. These novel technologies are more and more used in our cath labs, and the available evidence showing efficacy and safety is relatively limited. So our aim was actually to compare two non-polymer-based drug-eluting stents, respectively the Biofreedom and the Create devices, in real-world all-comer patients. The study is based on two large-scale Italian multi-center registries that have been conducted between 2012 and 2016 at several Italian centers. In both registries, patients included were patients with coronary artery disease, including any form of coronary artery disease ranging from stable coronary artery disease to acute coronary syndromes with or without ST elevation, patients that required PCI, therefore a true real-world population. What we did was to combine these two large registries and end up with almost 2,400 patients included in the pooled registry. And what we did then was to perform a propensity score matched analysis, ending up with 640 matched pairs of patients treated with the Biofreedom or the Create stent. So overall, 1,280 patients undergoing PCI because of coronary artery disease. Our findings, our pre-specified primary endpoint was target lesion failure, therefore a composite of cardiac death, myocardial infarction, and target lesion revascularization. What we observed at 12 months follow-up was a comparable result between the two devices in terms of target lesion failure. The event rates were 4.0 with the Biofreedom device and 4.2% with the Create device, so very comparable event rates, indicating a similar safety and efficacy performance of these two devices at 1 year follow-up. Diving into these individual components of the primary endpoint, we observed some small differences in terms of event rates, with a slightly higher event rates for TLR with the Create as compared to the Biofreedom, however not reaching statistical significance. Overall, however, very comparable performance at 1 year with the two devices. What was of particular interest was the results of the stratified analysis of the primary outcome by principal subgroups. And what we observed was a consistent finding across the major subgroups. However, we did observe a differential treatment effect by diabetes status, with a significant interaction between treatment effect and diabetic status, indicating a more favorable result of the Create device in diabetic patients, as opposed to a more favorable results of the Biofreedom device in non-diabetic patients, which is interesting based on the fact that there has been previous evidence indicating an advantage of the Create device in diabetic patients. And this is another important piece of evidence which actually supports future research evaluating the potential advantage of Create specifically in diabetic patients. For practice, I think that the first answer of this study is that these two novel technologies, in terms of event rates, they perform very well, particularly if you compare these event rates with event rates coming from all-comer trials with contemporary metallic drug-eluting stents based on polymer coatings. So since many interventional cardiologists still ask whether polymer-free devices are comparable in terms of safety and efficacy to other contemporary drug-eluting stents, well, the answers appear to be yes, meaning that these devices perform very well in regular clinical practice. On top of that, we also have an answer on the comparability between the two devices, specifically the Create and the Biofreedom, and the studies tells us that they are very similar in terms of outcomes at 1 year, in terms of both safety and efficacy. And finally, it may inform clinical practice regarding diabetic patients, since what is being discussed, so the potential advantage of a new technology such as Create in diabetic patients, well, it appears to be confirmed also in this study. Therefore, in perspective, having additional evidence on this device in diabetic patients might change our clinical practice. There are two lines of research that I expect after this study. On a side, a comparison between polymer-free drug-eluting stents and polymer-based drug-eluting stents, meaning that what we are missing is a large-scale randomized controlled trial directly comparing these novel technologies against the benchmark of polymer-based drug-eluting stents. Actually, the SORT-OUT 9 will be presented at TCT this year, which directly evaluates the Biofreedom against the Orsiro biodegradable polymer-based stent. And it will be interesting, this will be a large-scale all-comer trial performed in Denmark, and it will provide us evidence on the performance of the Biofreedom against a benchmark for safety and efficacy such as Orsiro. And on the other side, so this is the first, let's say, the first kind of studies that I expect after our study. And the second one is, well, a large-scale all-comer trial that evaluates the efficacy and safety of the Create, specifically in diabetic patients, since this consistent signal of a potential advantage of Create in diabetic patients needs to be proven in an adequately designed RCT.